you think, imagine if they could just prescribe exercise in
Mm.
like the doctor surgeries, or a better diet and pointers of how to achieve that, or more sleep, or ways to combat stress, rather than perhaps like giving them a prescription and sending them away. And I guess that's the nature of it all. But also, it's so psychological. There's so much, I guess, psychological baggage that you will probably have to deal with. Do you ever feel like you're like a part-time therapist as well? Because you kind of have to navigate all of that to, I guess, see what the causes are, what the triggers are, and then get an action plan from that.
Yeah, I mean, yes, but I'm also very conscious to work within my scope of practice. And so I'm often referring clients if there is a lot of history of trauma or emotional stuff going on to work with therapists. However, I have done further training within the realm of nervous system and nervous system regulation. So that's why I now focus on that so much, because that is a way that I am equipped to support clients that goes beyond just looking at physical symptoms. And I also just wanted to comment on something that I thought of when you were talking about, it would be amazing if doctors could prescribe these things. And you also mentioned in the question before around, is natural medicine kind of in opposition to conventional medicine? And I really want to emphasize that I am such a big believer in an integrative approach, and acknowledging that doctors do an incredible job with their patients. However, in most countries around the world, the way the healthcare system is set up is that they only have 15 minutes with someone, and them working within their scope is not necessarily being able to coach someone through making changes to their lifestyle or exercise or diet. So I think the complementary approach of more conventional medicine and natural medicine, you can say, is very, very powerful, and it doesn't have to be one or the other. And pretty much all of my clients have a GP, and I'm often referring them back to their GP and working integratively.